Well, more than $100 million has been paid out from the default superannuation fund for public servants and military as part of the government's early release of super scheme. The public sector superannuation scheme has paid out over $23 million. But given public servants haven't lost their jobs in this crisis, you've got to ask, on what grounds have they been paid out? And I'm not the only one asking. The tax office is also asking about this. Let's get my panel's perspective. Former Labor Minister Stephen Conroy in Melbourne and social commentator Prue McSween in Sydney. Stephen, you help me out here. All these public servants getting early access to their super because they have lost their jobs. That's what it's there for. But they haven't lost their jobs.
This is, I'm afraid, a bad policy from inception. But I do find, like you, how on earth have the fund approved hardship cases when there is no, by definition, job loss, unless there's a large cohort of retired public servants who suddenly decided to claim. So we might need a little bit more information. But on the surface, it is hard to see how the fund have met any sort of guidelines to make these payouts.
Well, in New South Wales, Prue, the Berejiklian government, they want to freeze public servant wages. Now, Labor and the Greens have already said they'll block any moves by the Premier. Now, they're not cutting the wages. They're just wanting a freeze on the proposed mid-year increases. I think she's got to do that, and they've got to support it, don't they?
Well, you'd think so. I mean, I'd love to have had a pay rise myself, as would most Australians during the last really couple of years. Many of us have not, seen any increase. But in this instance, where we're all suffering so much, business is really doing it tough. I think it's perfectly reasonable. My only concern is that it didn't stop the fat cats, the bureaucrats, getting very hefty pay rises. I don't know why they're a privileged class, and I can understand why the Greens and Labor maybe are putting themselves out there, because it's the frontline staff, the nurses, the police, etc., who have been really doing it tough, are the ones who are likely to get that 2.5 increase. So it's a hard sell for Gladys from that perspective.
You are very good to remind me about that, because some of them were in the order of $30,000, $40,000, $50,000 pay rises, not salaries. Pay rises, and you're right, they're
Incredible.
Coming into this decision. The ordinary front-facing health worker won't get the increase, but the fat cat and running the health department has got that in the bag. That's not been held back.